Welcome back. It's Dr. Novo. I'm here with Dr. Saluja, and we have our safety episode. Given the times, we thought it would be some pertinent topics to review some information that we use on a daily basis. And when we were forming our practice, there was really kind of the pillars were 3 words, and safety was one of them.
Yes.
It was kind of our first beginning of our brand was skillful, safe, and synergistic care. So this has always been on the forefront of our brand, and now it's in everybody's news feeds.
Yeah, awareness now.
So we wanted to designate a full episode to safety and how we handle safety on a daily basis, or since it's ingrained in you from a medical student onward. So we kind of have been living universal precautions. So we're going to talk a little bit about that.
And then what we try to do for our immune systems.
Right. And
I think everyone wants to know what everyone else is doing.
Absolutely. And then some unique features to some procedures that we have and how that's clean and safe in our office. So universal precautions, it's being kind of thrown around in the news and on your emails, and we really just wanted to define that for everybody. It's kind of
What are universal precautions?
It's guidelines that are really used to implement everything from the start to finish, how you handle a patient, how you come into contact, anything as basic as washing your hands or sanitizing your hands in between patients, wearing gloves, protective, gloves and masks, and then all the way, how do we handle waste, how we discard waste, such as biomedical. So that's a process and protocol that every medical office should have, and we've had. So it's just basically how you handle interactions with others and maintain cleanliness, really.
What's the goal of universal precautions? Why do we follow them?
We're protecting patients, protecting ourselves. So you kind of assume everyone is infected with anything.
Right, it's infection control.
Right.
So that's part of our medical practice, regardless of virus or no virus.
Right. So Dr. Saluja hit it on the head. This is something that's always been in place and will not change. It's only, I think, a heightened awareness. So as we move around now in the community and in and out of different businesses, I think people are going to be more aware and pay attention. We're going to have more savvy consumers and patients paying attention, even though this has been our fundamental, really, for most of us.
So we always wear gloves when we're handling patients. When do you decide to wear a face mask or goggles or a gown, those extra things?
Yeah, so always in surgery, I'm going to wear a mask. It's a proximity. We're all aware of social distancing now, but anytime I'm going to be close to a patient, open skin, really, anytime I'm opening the skin, whether that's surgically or resurfacing, or really how close I am to that patient, I'm going to wear a mask to protect the patient and myself, minimize any contamination. Gloves is really anytime I'm touching a patient's skin. Sometimes we'll do skin exams for feel by touch, but anytime the skin is open or compromised, you're going to wear gloves.
Right.
Or you're injecting.
Right.
And then glasses, really, anytime there's particles, any risk of droplets or bleeding or any plume. Like when I resurface, I'm going to wear protective glasses, and the patient's eyes are protected in those situations too.
Right. So it's really beneficial for both patient and
absolutely
practitioner.
Mutual protection.
And then what do you do with the needles and it's important how we dispose of needles and blades as well.
So every room has a sharps container, and the sharps go directly into the container. We minimize recapping, minimizing any risk that you're going to stick yourself. So sharps go right into the biohazard container. It's a one-way container. Can only go in. And then once it's gone, then we have a container that gets picked up on a regular basis, kind of a main bin where those bins would go into. And that includes sharps, and then biohazards would include any soiled blood or fluids.
Right. I think one of the things I'm really proud of in our office is that we have an emergency protocol drive. We have a place where in case there is a needle stick, or in case there is fainting, or in case there is exposure that we were not anticipating, we have protocols and processes we can follow to help. always better to be prevented and proactive, but if
Right.
not, then also having a framework in case.
Right, a plan.
A plan, yeah. I think
Absolutely. And that's how our staff is trained.
gotta have a
and
plan.
it's from front to back. Everyone in the office has to be aware of that and
So
execute it.
that is important. So PPE is like a big word right now,
Yeah.
or
So
big acronym.
PPE
So what is PPE?
Right, PPE, you don't know. So PPE, personal protective equipment, is really kind of a blanket terminology, and it would vary on situation, right? My PPE is different from a fireman's PPE, but it's still PPE.
Right.
So if you're rushing into a fire, you're going to have different PPE is a good analogy. COVID related or virus related, the standard would be an N95. If you're around someone who is suspected infected or proven infective, it's going to be very different from a daily PPE. So heightened awareness.
We use N95s in dermatology when we're burning warts because the
Yes, the
HPV
virus.
virus, the human papilloma virus, become airborne when we're burning warts.
Yes.
So N95s are really important to help when we call electrodesiccating or burning warts.
Right. So the N95s are kind of what's been all over the news as being a shortage. And so if you're near someone who's suspected or is infected, it's going to be an N95. And we're actually encouraging to wear a surgical mask over that. That would be more disposable because you're really trying to protect your PPE. Obviously, if you're around someone that's contaminated, you're going to change that. And then, so aside from the mask, you're going to have glasses or a shield, and then a gown, like a barrier gown, and gloves. So that's COVID-related PPE. And then on a daily basis, our PPE is glasses, surgical masks, gloves.
I have to tell our front team, in case they have to help in the back, they also need to think about footwear.
Yes.
We should have closed
No,
footwear. They're like, why can't we wear
exactly.
pretty heels? No, we can't wear pretty heels.
Right.
Pretty pumps or pretty flats.
It's in our dress code policy, right?
Yeah.
I mean, a medical office should not have open-toe shoes.
And that's part of PPE.
sandals, right, shoes, because heaven forbid a sharp drops on your feet and then you're exposed. So absolutely, that is part of PPE. So I think that covers PPE. And
I heard of something, we don't do it in our office, but it's called a Papper. You know that? Papper respirator, PAPR. It was a new acronym my brother in anesthesia taught me. I'd heard of it, but I'd forgotten. But Papper is a respirator that they have to use when they are intubating.
Oh, kind of like a negative or a positive pressure.
The whole
suit
that goes above, over your head, and it's battery powered or powered to blow oxygen in.
Okay.
I was I was happy we didn't have to do Pappers in our line of work.
It is scary when you see on the news and the ERs in New York, they look like spacesuits. I mean, they're covered. And
the nice thing about what we do is that we have a lot of healthy patients. It's pretty. If you're sick, stay home, right? Get some rest. Those are not patients that typically see us. It's patients that are healthy and ready to do elective treatments, or also there to get screenings, which when you do a skin cancer screening or procedure, generally you're healthy when you're coming in.
Absolutely. And we have implemented, no travel within the past 2 weeks to come into the office, and no fever, obvious symptoms, fever, cough. And that goes for our staff too. We've sent people home who have had like a dry cough until they're tested, and it's safe.
Changing times.
So I think it's important along the topic of safety and universal protocol. You are the top injector in Central Florida. We see such high volumes of Botox and fillers and Sculptra and Bellafill. What's your checklist and what distinguishes you from what should people pay attention to if they're going to a med spa versus a medical setting and they're getting their injections, as far as cleanliness and
so I'm going to
safety?
focus. I'm going to focus on fillers because fillers are like temporary implants. So it's the closest to a surgical procedure that I'm doing on the injectable realm. And I like to think of it as 3 periods. So pre-injection, during injection, and post-injection. Pre-injection, I think screening is important. Do you have a history of cold sores or fever blisters if I'm going to inject lip filler, right? Because the trauma of the injection may may trigger
Right.
a cold sore, fever, blister, the HSV virus. So our patients are going to use famciclovir or valciclovir to prevent that. So I think that's important to know. Obviously, if there's open wounds on the face, we're
Right.
not going to inject in those areas.
And it's important. Our staff tries or does remind people to come with a clean face.
Oh,
It's
I think a
also-
clean face is important, yes.
Right. It's also important if you're going for a procedure, part of your role is to come with minimal makeup. And I mean, we clean that off regardless, but you can help ensure your own safety by having minimal on your face.
Yeah, wash your face before you come
Yeah.
in. That would be ideal. And if not,
Now
we
ev-
will help you.
Now everyone's more comfortable not wearing makeup.
Yeah, and washing faces,
Yeah.
right? It's acceptable.
So pre-screening.
So I think
Clean
pre-screening is
face.
important. I think clean face is important. I think one of the other things we have really implemented a lot more in recent years is dental procedures. No dental procedures 2 weeks before your filler injection. No dental procedures 2 weeks
Okay.
after.
Cleaning. Like, does that involve a cleaning or more invasive work?
It depends.
Yeah.
At
On their
this
health,
point,
on their gum health.
Yes. So
Right.
I think at this, safer is better.
Right.
So dental cleaning is what we would consider also not urgent. So
Right.
filler also not urgent. So if you can space
Time it,
by at
yeah.
least 2 weeks apart, I think that's important. There are bacteria in the mouth that can dislodge, and they can find their way to fillers. And those 2 weeks are important to respect.
Right.
And I think a lot of us are going to have a lot of patients too will have more respect for those guidelines and following
Right.
those guidelines. And sometimes we do. We have to say, no, let's wait 2 weeks if the dental procedure is of first importance.
And we're both very risk adverse. So, day in and day out, what we're trying to do is minimize complications, optimize outcome. So, sometimes we do have to send people home or reschedule, and it's really for safety, the bottom line.
It is.
So,
It is.
no dental 2 weeks
dental,
before
right?
or 2 weeks after.
Yep. And then we got the makeup clean face because we don't want makeup particles traveling in with those
Right.
fillers. And then during injection, right before we inject, we're going to clean the face. Usually
Again.
2 layers, alcohol, and then chlorhexidine is what
Right.
I use.
And that's what I use in the OR. I mean, it's a surgical grade scrub that removes any bacteria.
Obviously, I am going to use hand sanitizer and gloves when I inject.
Right.
I once saw somebody inject without gloves.
Don't ever let anyone inject.
I couldn't believe it.
Cringe-worthy. Do not let anyone inject anything into your face with bare hands.
Yes,
Take-
should be wearing gloves.
That's a highlight. Take home.
Yeah, sometimes you can't believe what you see sometimes. Okay, so during injection, we want to avoid touching the hair or parts that have not been clean. We want to avoid touching the needle. We want to really keep the needle only injecting,
Right.
and minimize touching it any other way. We want to actually
Single-use needles
yeah.
come
Yeah,
out of a
of course.
sterile package. Just emphasizing
things
maybe
that-
the obvious, but
Yeah.
not so obvious. And you can
Important.
pay attention as a consumer.
One of the things that sometimes the goal is to make injections look like an art, and it's
Right.
this is flowing super easy, but there are decisions that are being made along the way. And
Absolutely.
one of the things I do is inject the lip last. And why? The mouth is the dirtiest
Right.
part of the face, so we're going to inject lips last if we're doing multiple areas.
That makes
We're going to
sense.
do a massaging of the lips last, and then discard
Right.
our gloves,
That makes
so that
sense.
we're not contaminating the face. And then post-injection. Post-injection is applying clean medical grade products, avoiding makeup until the next day, avoiding extreme cold, heat, exercise until the next day. We want to be available in case there are concerns or questions, so we want to really have you in town for 24 to 48 hours
Right.
minimum after. And I know a lot of people want to get injections and then travel, and we're all traveling so much in our lives, and so the goal is that 48 hours, sit tight, make sure everything is heading in the right direction, and then
Right.
and
It's
then
not
go.
that travel in itself is a risk. We just like to be available and have access and just make sure everything is
Yeah, the
as
rare chance of
perfect as
complication is
possible.
going to happen in those 24
to
to 48
48
hours, and so you want to be near your doctor at that time.
That's right.
And those are the checklists: the pre, the during, and the post.
I love it. And we also have printouts that patients go home with. It's reviewed before and after, and they go home with material, and we're always available for questions.
I think sometimes it's hard to read post-treatment instructions, and it's the most important part of one of the most important parts of your care.
Right.
And it's kind of like, okay, well, I had my treatment done. Now I just want to move on. And I think I urge our patients or patients out there to read the instructions that you get when you're having a procedure.
Right. We've spent a lot of time, hours, days on making them clear.
They're there for a reason.
Yeah, specific. Awesome. So I think we have unique, should we break? You want to talk about Hydrafacial?
Yeah, let's talk about Hydrafacial and then break after.
So we're going to cover one more topic and then take a short commercial break. We have a unique procedure. You probably heard of Hydrafacial. It's probably one of my top 5 personal procedures I've had. And a patient the other day.
Someday you'll have to tell us about your other 4.
I will. This is top 5. Sculpture's up there.
Okay, good.
Botox, Sculptra, Hydrafacial. Okay. So Hydrafacial, the other day a patient said, what's the difference between a Hydrafacial and a regular facial? Anyways, I was like, everything, So we've kind of prepared some really interesting pearls about Hydrafacial, what makes it unique as a facial, why it's relevant to being such a clean procedure. Do you want to talk about those pearls a little bit?
Right. So Hydrafacial, our favorite medical facial, has 3 steps. And the 3 steps, generally we cleanse and peel first, and then we extract and hydrate, and then we fuse and protect.
So it's a very specific suction extraction vacuum that's going to clear out all there's a trending hashtag. It's not junk. What do we call it in the canister?
Oh, it's junk. Skin junk. It is. It's skin junk, and then it creates a skin glow or a dewiness to the skin after, because we're exfoliating, extracting, and then we're infusing great growth factors or brightening agents. But I think you see this machine. It looks like a combination between a computer and a car wash,
right,
for your face, right? So you wonder, is this clean? How clean is this?
Right.
Am I sharing things with other patients? Is there contamination? What's done?
Well, the tips are single use only. So it's
tips are gone.
Right.
Opened and
no
gone.
recycling.
The tubes are one directional with a vacuum, so fluid can only go one way.
Right.
I think that's important to know. And I think, these are questions that sometimes we don't stop and ask, but we should.
Right.
There is a self-cleaning mode, and so the machine is cleaned with a cleanser that circulates through the whole system after each treatment.
Right.
And that's important. You don't want someone else's junk.
No.
Skin junk.
You can look and admire your own junk, but it's the cleanest your skin will ever be. And I think in a dream world, I would do one once a week. That's not realistic. But once a month, every few months, just as a really good purge of all those pores.
It is. Yeah.
I love it.
Yeah, if you haven't had one, it's definitely worth having a Hydrafacial, and and the safety features are clear, so that helps.
Awesome. So we are going to go to a very short break, and then we're going to talk about a couple of things like virtual consults and how our clinic has shifted during COVID.
Hey, this is Trisha Schmalhofer, hostess of BAM, Badasses, Alchemists, and Mystics. This podcast is all about seeking knowledge, talking to experts, changing perspectives, channeling wisdom, and shifting consciousness. Listen as we invite a different badass guest each time from a variety of career fields who are living their purpose, spreading light, giving strength and hope, and changing lives every day. We stream live on Facebook, so like our page, interact with us, and watch the behind-the-scenes action. Find BAM, Badasses, Alchemists, and Mystics on Spotify, iHeartRadio, and Apple Podcasts under Space Coast Podcast Network. BAM!
Are you in the market for a new home? Perhaps you need to sell your old home and downsize or relocate. Hey there, my name is Jesse Hall with eXp Realty, and I offer professional real estate services right here on the Space Coast. Give me a call, 321-877-8737 for all of your real estate needs. Again, 321-877-8737 for all of your real estate needs. Buy, sell, invest with the best. Find out more at 321-buysellinvest.com.
Welcome back. We are going to talk about a few more topics, including virtual consults, our immune systems, and some shifts we've seen in the practice.
Yeah, so we can't do Botox in a virtual consult. What can we do, Dr. Novo?
So I'm using virtual consults a lot, really not as the be-all, end-all. I still want to see my patients, but it's a really nice conversation starter. So I did a couple today. Follow-ups are great. You know, if they've had a procedure and there's really no issues or concerns, we can talk, kind of set up the next step,
Right.
what that will look like, timing, review skincare, procedure instructions. We're doing new patient consults. I did a consult today for a breast lift, breast reduction. I think it's just a really nice way to meet patients. And then from there, we can dialogue about what their objectives are. We send them out a quote through email, and then we'll follow up with them and schedule an in-person when the timing is right. So I think it's a great tool that we're implementing now.
Yeah.
And I do see that not as the mainstay, but an awesome option. I think it's convenient for people. We do get people that travel, and they're kind of, we're exploring if we're the right fit mutually, and I think it's very efficient and a really good conversation starter.
That makes sense.
Yeah.
I'm glad we have it.
It's awesome. Yeah. So I plan on using it long term. We implemented that given, that we are going to take a prophylactic pause, COVID timing.
Now we just need to have robot hands that
That's
come out
right.
through the phone that we can guide.
Soon. Don't give away all our secrets.
So I'm going to pivot a little bit and ask both of us really, how's our practice shifted in this time? How are we going to shift, or how are we planning on staying shifted? I know that obviously we'll have sick patients get some rest and reschedule. We'll have sick staff get some rest. I just purchased preventative fabric masks and glasses for our team to use as appropriate, as needed. I think we're going to use a hand sanitizer and not a water dispenser going forward, and keep social distancing measures in the reception area.
We've always been cognizant of space and trying to create a more private, spacious environment. I think that's why we have expanded in the past 2 years, and we look to expand as part of safety and that patient experience to give people space and privacy. So I see that only improving over time.
One of the cool things I learned is that we can now do a no-touch checkout, and that means you don't have to touch any credit card terminals. Or
even though we wipe if you do, but no touch is better than
no touching. We accept Apple Pay, Google Pay, Samsung Pay. I didn't know that. I learned it. So I think some of this downtime has helped me learn more things that we actually can do that will help patients and help the practice in this shifting to more awareness of what we are touching.
Right. Yeah, and we've even thought about our next phase is going to have ways to open the door without touching with the hands even, where you can use your elbow or your back
to open the door.
So even, flow changes like that, I think we're more conscious of.
Yeah. So I have a question for you. What are you doing personally for your immune system?
This is a great question, and it's always a struggle because we're all tired, but I think sleep is important. I think in this is going to sound silly because we're in an era of social distancing. But I think for low-risk people like your family, I think contact, like hugs, I think affection is important for your immune system, even if it's a hug. I feel like we feel
when you
more
have a 3-year-old
isolated.
and then I have an 18-year-old and
Dog,
dogs.
Yeah,
that'll
so
work.
just I think anything that's going to make you, maybe it's triggering a smile, and that's why it's good for your immune system. I've definitely upped my vitamins. One of our teammates introduced me to Ppe, so I've been taking more B12.
Emergency
trying to
C and
be
Ppe. There we
emergency
are.
C, trying to be religious about my vitamins, getting a little exercise when I can. Those are kind of the basics.
So
are you doing?
I'm a fan of vitamin D.
Yes.
So I take between 2,000 and 5,000 international units a day. I have added vitamin C. I'm using a brand called Smarter Vitamin. It's all
Smart.
out right now, but yeah, I like
She's
the
so
name. I like the name and the form of vitamin C that's in it. I'm taking a zinc and zinc with copper supplement. When you supplement zinc long term, you're supposed to have a little bit of copper.
That's like
in the
Zycam,
supplement.
right? When you're getting a cold, the zinc is supposed to be a little bit protective.
It helps prevent against viral infection. I've heard some interesting research on alternating hot and cold temperatures in the shower. So there's this ice cold method called Wim Hof that's famous, and so I'm doing a baby version of it, and I've started at the end of the shower to do 3 cycles of 3 minutes hot, 30 seconds cold.
So is it like
and
hot
finishing
max,
with cold?
Cold max?
So cold, yeah,
without
hot
burning
and then
yourself?
cold, and then hot and
I'm gonna
cold.
Google that.
So so whatever, it gives me some energy and feels like I'm doing something in the
Interesting.
shower.
What is
even.
the thought? What is the thought?
It
Not to put you on
activates
the
your
spot.
innate immune system.
Okay.
Helps your innate immune system get stronger.
Okay.
So based on looking at cells such as
I love
natural killer
that.
cells and whether they're
love that.
getting more activated. So that's what I'm doing. And then, sleep is important, but that's a work in progress.
hard.
I'm not
It's
finished
hard
with what I have to
when
finish in the day. So
there's stress.
melatonin some nights, 2-minute meditation some nights, Himalayan salt lamp some nights. All the electric
I love
screens, right, are on orange. I have this diurnal beats that's supposed to help you get into deeper sleep. So that's the diurnal beats app.
You have
I'll
a
use
lot of
that.
tools.
I have a lot of tools, and I'm proud of them.
That's awesome.
I don't use them all the time, but they. Some days you need some tools. Other days you need other tools.
I agree. Anything else that we need to cover? We have 2 minutes.
I'm done.
Okay. Thank you. We hope that this was really informative, talking about how we implement safety, why it's important to us, why it should be important to patients and the consumer. And we thank you for listening. We're getting great feedback, so we're going to keep going. We'll see you next time.